Hospitals across the state are overwhelmed as the number of pediatric RSV patients continues to grow. And here in mid-Michigan, healthcare workers say the virus is spreading at a higher rate than in previous years. Thanks for joining us for the news at 10. I'm Elise Ramey. A pediatric doctor tells TV5's Lanita Brooks how a local hospital is handling the influx of young patients.
It's terrible. It's really bad. We're having a pretty significant season.
RSV patients have hospitals across the state overwhelmed as they are struggling to keep up with the number of children coming in. Hurley Medical Center in Flint says pediatric beds are at 100% capacity with children who have the virus. And as of yesterday, 90% of hospitalized patients in the Covenant Pediatric Unit in Saginaw were RSV positive.
In the last couple years, it's definitely worse than what it has been. We during COVID, it was pretty quiet. We didn't have a lot of patients. This year, we're seeing kind of an earlier surge of patients and more volume for sure.
RSV often starts out similar to a cold with symptoms such as cough, sneeze, and a fever. But as the virus progresses, it can sometimes lead to more serious and even deadly symptoms like shortness of breath. So far, one death has been reported in Michigan.
The majority of kids will do fine from it, but they need hospitalization. But there has been kids that have died from RSV virus.
She says children as young as 1 month and as old as 6 years have been coming in, spending an average of 4 to 5 days in the hospital. She adds that regardless of how busy the hospital may be at any given time, parents should not hesitate to bring in children who need immediate attention.
If they see your baby come in and they're breathing hard, they will triage them and get them back as quickly as they possibly can. And they notify us quite quickly if there's a baby that needs more support than what expected.
RSV is often harder on children who have underlying conditions such as asthma and bronchitis. Parents who notice their baby is in respiratory distress should seek immediate help. Reporting for WNEM TV5, I'm Lanita.